Okay, good afternoon, everyone. And I do also want to thank the Roundtable for allowing me to present today. So just like the other panelists, I'm here to discuss a little bit about the regulatory and health policy issues concerning consumer genomics. Just to give you a background of who I am a molecular pathologist by training. I work up at Northwell Health up in New York. And I'm also the chair of the Professional Relations Committee through the Association of Molecular Pathology. So why that's relevant is I think using the Association for Molecular Pathology position statements is a really nice construct to be able to understand the evolution of consumer genetic testing throughout its life cycle. And particularly also in terms of some of the concerns we have today in terms of regulation and privacy. So back in 2007, I think it was very consistent with some of the community's interpretation or worries about consumer genetic testing is the consumers being able to safely consume that information. So back then, our position statement did reflect that, and we really felt only really comfortable with such testing being ordered and interpreted through the context of a healthcare provider. In the context of regulation, was mentioned somewhat earlier, is that as these results are healthcare information, we did feel very strongly that these results should be generated in a laboratory under the clinical laboratory regulatory environment, which is CLIA, or the Clinical Laboratory Improvement Amendment of '88. So the industry subsequently evolved, and in 2015, with our position statement had changed as well. So we began to realize that direct-to-consumer testing is likely here and here to stay, and that it did provide some value, and we did actually change our position to approve and support direct-to-consumer testing, however, with some conditions. Of course, we kept the regulatory environment in terms of the CLIA environment for the laboratories themselves, but we really focused on the intent of the testing. I know much of our conversation today has really been focusing on healthcare-related consumer genetic testing, but there were others in the field, particularly the business-driven, which we chose to oppose. This was consumer genetic testing where the company would then offer secondary services for sale in the back end, targeted to those consumers, vitamins, movies, videos, books, et cetera. Obviously, we did support healthcare-related consumer genetic testing as long as certain conditions were met in terms of regulatory, and we remained neutral on ancestry and recreational testing. This was because we felt that the risk of the information to the consumer was not particularly high, and at the very least, one of the positive benefits from it could be that just to increase the overall genetic literacy amongst the general public. So again, the world evolved, and in 2019, earlier this year, we updated our position statement with really an expansion of both breadth and depth in terms of our thought process. And again, I wanted to use this as a construct because we really felt it represented the community at large as well. Of course, we got into much greater detail in terms of the clinical space, transparency. When I say transparency, transparency to the consumer so that they can understand in their terms the analytical and clinical validity of these tests. Of course, again, the CLIA environment reigns true. And really we focus on the consumer and putting those wraparound protective services around the consumer. Education, making sure that these consumers are educated, that they know the limitations of the test, what is the impact on the consumer themselves, and then the impact subsequently on their family members. Again, referring to limitations, what a negative truly means. Is it truly negative? And likewise, the association, what a positive means. Does a positive truly mean you're going to have the disease? There was some mention earlier today about comprehension, and we feel that that was something very important, and we know at least part of the FDA approval process involves comprehension studies. And finally, we always felt that it was appropriate to have that backdoor to refer to either genetic counselors or any other healthcare provider that has the appropriate genetic background to be able to support these consumers. What was new in our position statement was a statement about privacy. And it really was only one single sentence because it really just pointed out to the Future of Privacy Forum. This was a group of consumer genetic companies. Many of you, I'm sure, may have actually participated in it. Back in July of 2018, where they really got up in front of some of the concerns that the general public had in their privacy concerns. I think in part it was likely due to also some of the recent law enforcement engagement with the consumer genetic testing companies, but also just the general concerns as well. And if anyone hasn't read it, I would highly recommend it. It's a 21-page document, and I think it was really thorough and really did a great job in addressing some of the privacy concerns of consumers. It really focused on three core pillars. One is promoting transparency, providing choices, and enhancing protections. And to get a little bit into details of them, the promoting transparency was really focused towards the consumer in their language to make sure they understand how their data will be collected, used, and shared. Of course, again, the educational theme rings through. And again, in reference to the law enforcement concerns, to have annual transparency reports in terms of which law enforcement agencies actually requested information from those companies. In terms of providing choices, it really delineated at least two levels of consent. One is the initial express consent, where these consumers can consent to the data usage pertaining to the purchased services. And then a separate and distinct consent for patients to allow these companies to share their data in terms of research, and other third parties. It set up kind of guardrails in terms of patient or consumers having access to their data, their ability to correct it, and remove it from anything that they previously consented it to be allowed to be used in the past. And finally, enhancing protections. It was mentioned before, companies should not share genetic data, particularly with employers and insurance companies. We know that's protected federally under GINA. But then other organizations such as educational institutions, of course, without consent. To create a legal process in which law enforcement can engage to make sure to be able to provide those consumers with assurances that anytime this data is accessed, it's going to be in a legal process. And finally, we all consider this data to be very private. For right or wrong, we're very sensitive about our genetic data, and that the best practice would be to employ strong data security practices to be able to protect it. And I think this is a good segue to get into some of the legal and regulatory protections. You'll see a little bit of overlap here. I did want to bring attention to HIPAA just one more time, because again, as these genetic testing companies themselves are not covered entities and do not fall under HIPAA, relationships that we see more frequently these days with either health plans or health systems, that data that's being transferred throughout that relationship is PHI, and those consumers are afforded all the protections as they would under HIPAA. Gina was already mentioned, and Dorothy earlier expressed some of her concerns of how, in a way, she felt satisfied that it was present, but really there were some serious gaps in Gina in terms of the protections for other forms of insurance products, life insurance, et cetera. Just to call out, and again, this is a relatively comprehensive overview of the legal protections, but the Americans with Disability Act actually predated all of this in 1995 and issued a statement that prevents employment discrimination based upon genetic information. And continuing in the federal level, the Code of Federal Regulations, I always get this wrong, Title 45, Part 46, for when your data is used in terms of research, you are afforded all those protections under that Code of Regulations. And finally, we hear about it quite frequently in terms of pre-existing conditions in the Affordable Care Act, and that does include genetic information as well in terms of attaining health insurance. But kind of before we go on to the next slide, kind of looking back and preparing this presentation, I was surprised by really how much protection there was in terms of privacy. But then I put myself in the position of a consumer, and how would I know about it? How do I know which one of these protections am I afforded? I kind of don't really know how my data would be used. So I think the perfect description here, it's a patchwork of protections, yet it's incomplete, and I think it's not particularly transparent for the consumer. So the states obviously have taken on their own protections as well. And you can see they started to fill some of the gaps that we saw at the federal level. The vast majority of states have undertaken protections against genetic discrimination and health insurance, similarly employment. A good number of states have covered some of those GINA holes in terms of covering for or protecting against genetic discrimination with life insurance and disability insurance. And a few states have actually even gone as far as long-term care insurance as well. Now, California has created their own GINA, and so the constituents in California are afforded all of the benefits of GINA, but then also it's been expanded to include all of these other services, such as emergency medical services, housing, mortgage lending, et cetera. So as I look at this, I certainly see an industry in evolution. I think the public's thought process around this industry is evolving, and the industry itself is evolving. The kind of first era, we were focusing in the clinical space, the appropriateness of such testing, the safety of such testing, validity, et cetera. I think now we're kind of really focusing on the privacy concerns that many of the consumers have. There's been a call for clarity and transparency. I think it's wonderful that there's been, although be it non-binding, there are best practices that have been put forward. And certainly there are existing legal and regulatory protections as well. But if I look into my crystal ball and see kind of what is the next evolutionary step that I see in consumer genetics, is really the incorporation into routine healthcare. I think some of the barriers we're going to have to overcome from a provider perspective is I think providers are largely unfamiliar with the tests. There are a lot of nuances that we discussed today in terms of genetic health risk assessments. What does that mean? Is it a diagnostic test? Is it not a diagnostic test? Some level of trust in the data. There's been a lot of media about the inaccuracies of some of these assays, right or wrong. And also, I think it's important to remember that many of the providers out there were trained in the pre-genetic era. Some of them may not feel adequately equipped with the knowledge to be able to incorporate genetic data that was brought to them by their patient. These weren't even tests that these providers had ordered. So I can imagine there be a gut reaction to push it away rather than to incorporate it. So that's the end of my presentation. I think we can go on to the rest of the panel. Thank you.